Hi guys, good morning. Welcome to another session of basically one of our AMAs with Dr. Behnam. I'm Dr. Behnam, board certified dermatologist and one of the founders of Happy Head. Today, basically, we're going to talk about the importance of vitamin D with hair loss. So vitamin D is actually very important because that is one of the vitamins that's actually necessary to basically for hair growth. I mean, unfortunately, we have a lot of patients that have low vitamin D, and honestly, I tell my patients that if you have low vitamin D, no matter if you take topical finasteride, topical minoxidil, oral finasteride, whatever you do, if you're not going to fix your vitamin D issue, you're really not going to get the best results. What I always refer to is called basically the four pillars of hair loss. And the four pillars, one of them is vitamin D, then a general, basically multivitamin, like a vitamin supplement, and then collagen and protein. So those four things are very important. And there are patients that come into our office and I tell them, look, before we do any prescription medications, just go on the vitamin D, add some collagen, protein, and take your regular multivitamin. And patients come back 4 6 months later and I swear they tell me that, doc, I feel my hair feels so much better. I just feel have more hair on my scalp and my shedding has really reduced a lot. So and also sometimes we do lab tests and we see that patients vitamin D is like 8 9 11 12. Those are very low numbers. So my ideal number for vitamin D is in the 40s and 50s. But the minimum number is like 30. So, but ideally, we want the vitamin D to be in the 40s and 50s. So, my recommendation is take about like 2,000 IUs of vitamin D on a daily basis. The Happy Head the supplement. Here we go. So the Happy basically supplement right here is important because it already contains high doses of biotin along with vitamin D, and also has other things in the multivitamin. So by taking the Happy supplement, honestly, you already basically checking off like a lot of stuff in that category that's going to help out your hair. So now we're going to go through some of the questions right here. So, Dr. Ben, I'm a healthy 50-year-old male, no history of hypertension and cardiac disease or kidney problems. I take Viagra on an as-needed basis. Based on the above, would you recommend against taking oral minoxidil because of the risk that my blood pressure could drop? No, actually, I have been prescribing so much oral minoxidil recently. I'm not sure if you guys are aware, but New York Times ran an article about a month and a half ago on oral minoxidil, and I've been writing a lot of it. And honestly, it's a very safe drug. The most common side effect of the oral minoxidil includes changes in blood pressure, like dizziness or lightheadedness, but for a guy, that's honestly very rare. Yesterday, I put a 95-pound girl, a young lady, on oral minoxidil, and she's gonna do fine. So my recommendation is always to titrate up the medication, do a quarter of a tablet, and then a half a tablet. Do a quarter tablet for 2 weeks, half a tablet for 2 weeks, and then a full tablet after that. If there's any issues, obviously cut down. But for guys, I think you're gonna do just fine. But thank you so much for asking that question. The other question that people typically ask is, can I combine the oral minoxidil with topical Happy Head? Yes, topical Happy Head has topical finasteride mixed with topical minoxidil and retinoic acid. And actually, I love when people use Happy Head because your body kind of gets used to the topical minoxidil component of it and acclimates to it. So when you start taking the oral, obviously your risk of side effects are lower. And you could definitely do the topical Happy Head along with oral minoxidil together, and patients will get better results. Also, if you do Happy Head, you could also combine that with oral finasteride, and you will get great results as well. This is what we call sandwiching. We have patients in our clinic. Again, I'm not recommending for everyone to do this, but we have patients in our clinic that are on topical Happy Head and later on add oral minoxidil and later on add oral finasteride. So they're on all these together. I mean, pretty much you're doing everything by that point. And they see great results. Now, talking about the oral medications, we are happy it will be the first company ever to introduce what we are referring to as the super capsule. What a super capsule is a combination of oral finasteride, oral minoxidil and vitamin D all together, basically all three in one. So it just streamlines the process. You're taking one medication as opposed to three, and patients will basically get better results. We've already been testing out this formulation. We've already been testing this out. So, guys, sorry about that. Some people might not see me on the screen, but I hope you guys could hear us. Okay, now again, Happy Head is a customizable product, which means that there are multiple different ingredients in it, just finasteride, minoxidil, and retinoic acid. And if you are experiencing any side effects such as irritation on the scalp, redness, flakiness, please let us know. A lot of the irritation is coming from the minoxidil and retinoic acid component of the product. So we could reduce the minoxidil or even take it away and also take away the retinoic acid. So again, so we are here to help you guys out. Remember, this is not a one size fit all. We understand that everyone's chemistry and genetics is different. So obviously their response to the medications are different. And will customize this product just based upon your needs and degree of hair loss. So if you're having any side effects, please reach out to us at Help and Happy Head, and we'll be more than happy to change some of those ingredients and send you a new bottle, basically free of charge. Also, in the last visits, in last AMA sessions, patients also asked a lot about the derma roller. Derma roller is really important part of the process. You don't necessarily have to do it, but if you do it, you will get better results. So our recommendation is that basically when you apply the medications topically on your scalp, you can take a derma roller that's 0.25 depth. 0.25 depth, and then you're going to roll it basically gently on the affected area just for a minute. Remember, you don't want to do it too aggressively. Don't make yourself bleed. You just gently want to basically roll it back and forth, and that will allow for better penetration of the medication into your scalp and for better results as well. I'm currently taking 5 milligram oral finasteride for my prostate. Is it okay to use Happy Head in conjunction with oral finasteride? Yes, absolutely. In fact, in our clinical practice, patients that take the oral finasteride medication and add topical finasteride see superb results. I have a lot of patients on it, so please do it. I think you're going to see amazing results. Let's talk about some of the side effects of finasteride. Some of the side effects of finasteride include sexual side effects. Again, orally, patients could have sexual side effects. With topical finasteride, in clinical studies, it's been shown that the risk of sexual side effects are lower. And if you're very sensitive, we highly recommend that you don't do the medication twice a day every day. So my recommendation is basically apply once a day. So do 2 pipettes once a day. And what I mean is that when you do basically 1 pump on the dropper, it won't goes to half ml. So the recommendation is 2 pumps twice a day. So you do a pump and you do the right side, and another pump and you do the left side, and you want to do that twice a day. However, if you're very sensitive to finasteride, maybe you just want to do it once a day for the first 2-3 weeks and then go up to twice a day, or sometimes people even do it every other day. So again, so just go up slowly. Just don't be very aggressive about it. Remember, it is not a race. That's one of the most important things. Also, a lot of patients have been asking, again, as our last gentleman asked, can I combine the oral with topical? And the answer is yes. You can combine oral and topical together, and you are going to see typically better results. With respect to how Happy It should be used, so I have a patient basically that this morning asked me the fact that he was losing basically some of the areas in the widow's peak. So my recommendation is do 1 pump on the right side, be about 2 inches above the hairline, and push it forward, and do another pump on the left side and then push it forward as well. Again, you want to do it twice a day, every day. And if you're doing it in conjunction with derma roller once a day, that would be great. The question that comes up with derma roller all the time is that, I've read somewhere on the internet that if you use 1.5 millimeter depth, you're going to see better results. Although that may be true, the problem is that honestly it hurts, doing the 1.5 millimeter depth. So we typically recommend the 0.25 millimeter depth. And that's because you're not gonna make yourself bleed, it's not gonna hurt that much, and honestly people still basically will see really good improvement. What about other supplements? So I know we talked about the vitamin D this morning. Biotin is also important, so we do recommend also doing biotin, and this is why in our supplement basically it contains high dose of biotin along with basic vitamin D. People also talk about, well, what other thing I can do basically to get better hair growth. So again, topical happy includes the finasteride, minoxidil, retinoic acid, all combined together. Other things you could do, as we said, add vitamin D, add biotin. For females, definitely add an iron, like a separate iron to your regimen would be great. Derma rolling is also very important, and also increasing your protein uptake. So protein uptake, by that what I mean, like eating more chicken, cashews, avocados. Those are all great. But also sometimes supplementing your diet with protein is also important. The two type of whey proteins. There's a whey protein isolate and concentrate. Whey protein isolate is used for pre and post workout, and the isolate has been shown to actually cause more hair loss. So if you're doing a whey protein isolate for workout, that's actually going to cause more hair loss. So I do not recommend doing that. Whey protein concentrate, it's great. You could easily find it on Amazon, and you can make a smoothie or a milkshake out of it. You could also add some collagen to it, and basically doing that every day, especially after you work out, is really going to help with the hair loss as well. Collagen is also another one that's very important. You could take collagen tablets, collagen tinctures. Those all will also help with hair loss as well. Besides those, I know a lot of patients also do creatine. Creatine is really bad for your hair. It will lead to hair loss. If you're doing taking creatine, stop right now. Do not do it. That's going to increase the testosterone level in your body, and it's going to lead to more hair loss. Also, we're not a big fan of energy drinks like Red Bull, Monster drinks. Unfortunately, a lot of those basically will cause shedding and more hair loss as well.
Is coffee fine?
Coffee is okay. Actually, caffeine is okay. There's nothing wrong with caffeine. By the way, we have Eric here, our VP of operations, right here. Um, Caffeine is okay. There's nothing wrong with that. But again, remember, what you eat is what you are. So if you're eating a lot of processed foods, McDonald's and things like that, you're obviously not going to have the best hair. But if you eat healthy and more organic stuff, you're going to have better hairs. Also, this question came up actually about a week and a half ago with one of my patients. Chicken. So I know we don't talk about this a lot, but unfortunately, not all chickens are the same. So we typically recommend pasture-raised chicken, and here's the reason: if you get chicken that's basically, if a chicken is in a cage, they feel trapped. So they're running around like a chicken. And as a result, that will increase the testosterone level in the body. So when you eat those sort of chickens, what happens is that you're eating actually a lot of testosterone, and that's going to basically to lead more hair loss. So what we recommend is basically organic pasture-raised chickens. That's what we recommend, and that's going to basically also lead to better hair. Um, Here we go. Hi, should topical minoxidil be used once a day or twice a day? Twice a day. If you read the clinical studies, basically twice a day what gave patients the best results. And with the Happy product, it actually has retinoic acid in it, and retinoic acid has been shown to increase the efficacy of minoxidil. So by using the product twice a day every day, we're going to give you the best results. Another question that people ask all the time is that, okay, I've used Happy for 6 months, 8 months, and I've seen the results, and it's great. What do I do then? Is there maintenance therapy, maintenance track? That's a great question. Everyone's different. We still recommend using the product twice a day every day, but there are some patients that get busy. And so as some patients use it like 3 times a week or 4 times a week, and in some cases that will maintain the hair, and I'm happy. So everyone's different, or sometimes they go down to use it once a day, and that works great as well. Obviously, if you go down to once a day and you start to feel your hair basically falling off again, you want to go back. I recommend you want to go back to doing it twice a day. But some patients could get away by using once a day, and that's great. Let's talk about our Aquas formula. So our Aquas formula is what also referred to as a water-based formula, is the same ingredients in a different vehicle. So we've come up with this vehicle that's mainly botanical based, and this vehicle basically reduces the irritation, basically on the scalp. So if you're experiencing redness, flakiness, irritation, we do have the Aquas formula. We'll be more than happy to switch that for you. Please reach out to us and we're here to help you out. Again, remember this product is customizable. So we basically make it for you on a monthly basis. So if there's an ingredient that you don't want to be in there, please let us know and we'll be more than happy to either reduce that concentration or to remove it for you. Also, let's talk about the most common side effect of happy is irritation on the scalp. So how do we reduce the irritation? The irritation comes from two parts. One, the minoxidil that's 8%, and also the fact that there's retinoic acid in the product, and the product is also in like alcohol base. So if you're experiencing irritation, for one thing, you could wash the product after 1 hour. You're still going to get really good results, but basically washing the product off basically means that the product is less on your scalp and causing less irritation. Number two, you could use less of the product. So instead of doing it twice a day, you could use it once a day. We also have a special serum that we will send you. So if the product is really irritating you, let us know. We will send you a special serum. It's just a hair conditioning serum that just basically calms down your hair loss. That calms down the irritation on the scalp. Also, we have the Aquas formula, so we could change basically the vehicle to something else that causes less irritation. So let us know. We'll change it out. And finally, we could remove some of those ingredients for you. So we feel that the minoxidil is causing a lot of irritation. We could remove the minoxidil, we could remove the retinoic acid, and ship you out the product basically with finasteride in it. And a lot of patients do that. So again, so we are here to help you guys out. You let us know what you need, and we'll take care of it for you. Other question that people ask, can females use Happy? Yes, we have a special female formula. So, and also it really depends upon what is your age. So if you're female above 50, you could use the regular Happy formula that has finasteride with minoxidil and retinoic acid. If you're a female below age 50, we have a different formula that has spironolactone with minoxidil and retinoic acid. So that's your formula. If you want to go on oral medication and you're female, we could definitely add oral minoxidil or oral spironolactone to your regimen for better results. And again, I do still encourage females to be using derma roller. For females, there's also called a derma stamp. We don't have that Happy yet. And what a derma stamp is that instead of rolling it, you're stamping it. So females with long hairs or guys with long hairs, it might work better because you're not going to be rolling it and you're not going to be pulling on your hair. Another question that somebody brought up earlier was that can females take oral minoxidil? And the answer is yes. Females can take oral minoxidil. Minoxidil, the oral blood pressure medication that vasodilates the blood capillaries and causes more hair growth to the scalp, and females could take it as well. And I've seen a lot of patients in my own clinic that see really great results with it. So how do finasteride and minoxidil work? So finasteride is a DHT blocker, which means it inhibits the enzyme that causes testosterone, that causes DHT production. DHT is responsible for miniaturizing your hair. So by reducing the production or stopping the production of the DHT, you have less hair loss, and as a result, you have more hair growth. Minoxidil works a little differently. It's a vasodilator. So basically, it dilates your blood vessel and causes more blood flow to your scalp. Happy combines both of those ingredients in there because we know that there are many different reasons for hair loss, and by including more ingredients, attacking the different causes of hair loss, you're gonna get better results. And that's why in our super capsule, we also have multiple different ingredients because we want to address the multiple different causes of hair loss when people take the super capsule as well. Eric, any questions that we should address today?
We could talk about our supplements that are
Yeah.
coming out. Should be out in the next week or two.
Yes, our supplements should be coming in the next week or two. So our supplements basically are specifically designed basically by us. And what we did was that we actually looked at the clinical research, the clinical data, along with all the supplements out there. And we wanted to include all the ingredients that were kind of like anti-DHT as well as ingredients that will promote hair growth. So what we did was that first of all, we made the vitamin D in our supplement. I think it's about 2,500 micrograms, like really high, so that which is great. We made our biotin in there about 6,500 micrograms. So I'm sorry. So our vitamin D is 2,500. I use our biotins is really high. It's 6,000 micrograms. And then we added ashwagandha to it, saw palmetto, vitamin A. We also added collagen and keratin. And also one thing that makes us really unique from other hair supplements is we added probiotics to it, basically because we wanted the product to get absorbed better. So our hair supplement, we truly believe it's one of the best ones out there, and it's very comparable to some of our competitors, and actually has even better, stronger, and more ingredients in there. So we're very proud of it, and it's going to be coming out in the next 1 or 2 weeks. So if you want it, please let us know, and we're going to have a special introductory coupon for it. Just please mention Dr. Ben, and you will get a discount. Besides that, we also have our hair, basically shampoo and conditioner. Again, I use this in myself at night. It has argan oil, it's a biotin collagen shampoo, and absolutely it's great. And again, we're always busy working to come out with better and new products moving forward. All right, guys. Well, thank you so much for joining us with another session of AMA with Dr. Ben. Eric is our VP of operations, basically who helps us with everything. And if there's any questions, please feel free to email us at help@happia.com. And we'll be more than happy to answer your questions. Guys, have a beautiful day. We'll see you next week for another AMA sessions. Have a nice day. Bye, everyone.